Hello and welcome friends to my channel. Thank you for logging in. I am Dr. Chirag V. Thakkar. I am an orthopedic surgeon and I practice joint replacements, fractures, trauma and arthroscopy. Today we are going to learn about osteoarthritis of the knee joint, which is called degeneration of the knee joint. So let us see what happens in osteoarthritis of the knee. So this is the anatomy of the knee joint, in which you see the bony as well as muscular structures of the knee joint. These are the muscles of the knee which surround the knee and protect the knee and make the knee strong. This is the kneecap. We call it patella. It protects the knee joint from the front. These are the two bones, one of the thigh and one of the leg, which form the major part of a knee joint. And these two circles show you the menisci or the shock absorbers of the knee joint. So let's see the X-ray of the knee. The left side is a normal X-ray which shows space between the two bones, which suggests that the menisci or the shock absorbers are intact. And the figure on the right, it shows there is reduction in the joint space and the bones are touching each other, kissing each other, which is suggestive of meniscal degeneration or degeneration of the knee and osteoarthritis of the knee joint. So what exactly happens in degeneration of the knee joint? You see the four images in the front, and the last image shows that the menisci or the shock absorbers are completely absent, making the bones touch each other, causing severe pain. That happens in degeneration. How do we treat it? Physiotherapy. Exercises are the mainstay of the regimen of treatment. Exercises increase the muscle power around the knee joint. Medicines. Certain safe dosages of medicines can be given to a certain age group. We may also inject viscosupplementations in the knee joint to increase the lubrication of the knee joint. We may also go for stem cell therapy in certain cases, and stem cells have proven to improve the cartilage regeneration and meniscal regeneration. In young patients which come with arthritis, we have to go for knee preservation, which is called high tibial osteotomy, in which we correct the axis of the knee joint which is bent. And lastly, when there are advanced cases with severe arthritis and old age, we go for a knee replacement. So knee replacement consists of replacing all the bones surfaces which are degenerated, and that's how it looks in our body. So that was something about osteoarthritis and degeneration of the knee joint. I hope the video was useful to you and the demonstration was clear. I request you to share this video with your family and friends so that many people can benefit out of it. Please do not forget to like this video and subscribe to my channel. Thank you.